My name is Fran Naylon. I've been a flight nurse here in Central Operations Alice Springs base for almost 5 years now. I came from Sydney. I was working in a tertiary big ED hospital and it was interesting. However, I've always had the yearning to work out in the outback. I love the work, I love the environment out here. It's a fabulous career opportunity because you get to meet and use all your skills in your nursing. You know, your paediatrics, your intensive care skills, your emergency skills, and just your everyday nursing skills. And we've got a great team here, so we're very, very lucky. And the team includes the pilots, the engineers, our clerical staff, which back us up, and also our retrieval doctors.
Hi, I'm Carolyn Elmeyer. I'm a flight nurse for the Royal Flying Doctors at the Alice Springs base, Central Operations branch. On a typical day, we may get a call out from our comms who get the call from Port Augusta, and they will page us and tell us what kind of job we are going to, which can be from a car accident to a heart attack to a sick child or a pregnant lady that's giving birth. So we have to assess from what the jobs are as to what equipment we need and what plane we need, whether we need extra support from the doctors or whether we also need to talk to our pilots about the conditions that in the communities that we're going to, and then we also have to work out what kind of equipment we're going to. So if we're having a heart attack, then we need to get the drugs and the cardiac equipment that we need to. If we're going to a midwifery patient, then we need to be prepared for a baby and take a neonatal cot and some extra birthing equipment. We need to really consider what the jobs are we're going to.
Welcome to my office in the sky. We have everything in an intensive care or emergency department have. So our office is very, very well equipped. It reminds me of a submarine. There's a place and a home for everything. So if I step onto a different plane and I know I need the airway equipment, I know I can go to the second drawer and get it.
So at Central Operations, Alice Springs base, we actually have 10 nurses. One's a senior flight nurse who covers our shifts if we call in sick. And other than that, we have 7 female nurses and 3 male nurses. We all have to be critically care trained and midwifery trained so that we can respond to any emergency out there. And we cover 24 hours around the clock. We do a 6 to 6 shift on a day shift. We also do a 7 to 6 shift that would take critically ill patients from Alice Springs down to Adelaide or Melbourne or up to Darwin. So that's a hospital transfer of a critically ill patient that requires further treatment that we can't supply in Alice. We also cover an afternoon shift from 3 till 10, and then 8 till 6 o'clock in the morning is done by our night shift.
I would recommend this career to anyone who would like to experience a different day every day. So it's not the same old routine every day. And you're working in an individual practice a lot of the time, so you've got to be confident in your own skills as well and maintain your skill base, which we're encouraged to do a lot, and we do work on it up here to maintain our skill base. So it's a great opportunity to be an independent practitioner, but as I said earlier, we do have a great team here and work with the Alice Springs doctors as well, because there is only one nurse on the plane generally, and that's you.
There's nothing more rewarding than actually giving a birth to a lady that can't get to the hospital out in a homestead, or saving someone from a car accident that is 500 k's away from a hospital, and knowing that you can get them back there safely and get them to treatment that they need to survive and become well again.
For people who are doing nursing and they want a career in nursing, I think go for it. Do what you like to do in as far as specialising. Get as much experience as you can. But if you're looking at this type of work, you do need your midwifery experience and you need your general care and specifically emergency and intensive care experience. And the thing about this job, it is a great passport to travel and meet wonderful people and their colleagues who turn into friends because of the camaraderie and the uniqueness of the situation. You tend to bind together quite well and you make lifelong friends. So it's a wonderful opportunity and I encourage anyone just to go for it and really think outside the square.